My name is Paul Reynolds. I'm a retired dentist from Glendale. I was a practicing dentist, and Carl came to town to start his own practice, and he and I befriended each other. We also became each other's dentist. You can always tell the quality and the respect a dentist has in his field when other dentists, other lab technicians, and physicians go to that particular person. And Carl has a fairly good following of the professional people in Glendale. I actually had what some people would call a full mouth reconstruction. Basically, I needed 25 crowns throughout my mouth. At the same time, I had lost 3 teeth due to grinding. I cracked the teeth, and Carl very carefully removed them and put in implants, which we were going to build up and put new teeth on. It was necessary because I was grinding my teeth away, and at some point, at 70 years old, in another 20 years, I would lose half the length of my teeth. So Carl and I decided together that we wanted to rebuild my mouth. Sure, you could always consider a denture or a partial denture, but Carl and I decided that we wanted to make me feel better, and especially make me look better, since I had worn at least a third of my teeth away, that we wanted to restore my mouth to what it was when I was a young man. Carl and I decided to do it over a 2-year period, going step by step and doing segments of my mouth at each setting. Sure, there's a little bit of chair time involved, 4 or 5 hours sometimes. Immediately, it was slightly uncomfortable, but long term, nothing. I was back to normal the next day. I can honestly say there was never any real pain. It was more uncomfortable. I know I look better. My lips are all scrunched together because I had lost what's called vertical dimension, or my opening, and Dr. Werts worked very hard to establish what my bite was when I was a young man. This is a procedure where you don't have to wear a denture. It's not something you have to take out at night and put in a cup. It's something you can live with for the rest of your life. Well, I feel much more comfortable certainly talking to people because I can see my teeth. I did have some jaw joint discomfort, and Dr. Werts, Carl completely eliminated that by opening my bite to what it was when I was a young person. One of the things I liked about Carl is he went slowly with the process. He did not try to do it all at one time, and that way, going segment by segment, you get a much better result. It was just such a relief to look at my mouth and floss and brush and see teeth again, not crooked things that were all broken. So yes, it was a worthwhile venture.